Welcome to Pronger Smith Medical Care, where patient safety and quality of care are very important to us. At Pronger Smith, our mission to deliver safe, quality care begins and ends with meeting the needs and expectations of our patients. Pronger Smith Medical Care is the premier healthcare facility of Chicago's southwestern suburbs. We have over 50 doctors, state-of-the-art technologies, highly trained staff, and are Joint Commission accredited. Our healthcare professionals are very friendly, open, and always encourage an honest dialogue with patients and family to assure the best possible care. Women are offered preventative care as well as medical care for acute and chronic conditions. Pronger Smith Medical Care offers a personal and complete approach to well-being for female patients. We are staffed by board-certified specialists in all areas of women's health. Women have their own set of healthcare needs, and Pronger Smith Medical Care has medical experts who specialize in their care. From annual gynecological exams to supportive care for osteoporosis and menopause, our providers can address all aspects of women's health. Women do have many health concerns, from premenstruation to postmenopause. Choosing the right doctor and knowing how to resourcefully navigate through all stages of your life can greatly increase your chances for a healthier, prolonged lifespan. Pre-screening, tests, exams, and consultations with your doctor are the keys to unlocking the hope for a more satisfying, healthy future. Our physicians know that reaching out and getting patients involved with their own proactive health care will change the face of medicine. Be healthy. Pronger Smith Healthy.
I'm Dr. Randall Gordon, and I'm a gynecologist. I've been at Pronger Smith for 25 years.
Hi, my name is Shelly Agrawal. I'm the newest OBGYN member of the Pronger Smith family. I just wanted to welcome you to this video here when we're going to talk about some of the common OBGYN things that you might experience or have questions about when you come and visit one of us. One of the other aspects that OB-GYN doctors will take care of is just overall women's health. What I'm going to do is kind of break it down based on age. When you're in adolescence, it can be a really confusing time because typically girls tend to have abnormal bleeding, they have abnormal cycles, they're going through a lot of changes and they don't know who to talk to about them. We're a great resource for you to bring your daughter in and we can just have a real discussion about what's going on and what to expect, and also things that they need to do and be aware of to start protecting themselves. Things like taking a multivitamin. In the 20s is when women get more interested in contraception, birth control, things like the IUD, we put in the Nexplanon. Also, on the other side, women get more interested in actually having children. So fertility, we can kind of do a baseline assessment of your fertility and make sure that you and your partner are able to get pregnant. Another thing is just routine gynae exams. Remember, it is recommended that over the age of 21, between ages of 21 and 30, every woman gets a pap smear every year. So it's pretty important that you come and visit us once a year so we can make sure we're assessing all of your needs. In the 30s and 40s, that's when, again, it's more about having kids, but also doing pap smears, making sure you don't have any concerns with your body, with intercourse, with abnormal bleeding. And then once you hit menopause, that can be a really interesting time because, again, it's not something that everybody talks about a lot, either in the media or even in the doctor's office. So
Mammograms should begin in all women at age 40. Between 20 and 30, we recommend a clinical breast examination. These would be exams that the physician would provide in the office and should be at least every 3 years. At age 40, we again recommend the breast exam and mammograms every year. Age is not a factor. This should carry on through the rest of one's life unless there were some debilitating medical problems that would not allow somebody to undergo a mammogram.
Breast cancer is a disease that's very preventable. It's really important that women do a monthly breast exam. That, coupled with a yearly mammogram, significantly reduces the amount of breast cancer that is diagnosed every year.
Another important aspect that OB/GYN doctors deal with is breast health. It's really important that you do breast exams after the age of 40, just so you know what your breasts feel like, because you're the only one that's with them all the time, so you're going to be able to alert us if something is abnormal. After the age of 40, we do yearly mammograms that can also help detect breast cancer in its early stages.
At Pronger Smith Medical Care, we believe that cancer treatment is more than just medicine. It's about compassion, prevention, wellness, and treatment for best outcomes. Although cancer treatment requires intervention, our team understands the importance of a support group to assist in the healing process. Our team of board-certified oncologists, hematologists, nurses, and other skilled professionals will work with you and your personal support team during your recovery course. In the rare event you should be diagnosed with cancer, we do have an oncology department here for our patients. We hope you may never need us, but if you do, we are here to cure your cancer with a team approach and to make the experience as painless as possible. We streamline a treatment plan that best suits your situation, needs, and wants.
I'd like to take a few minutes and talk about endometriosis. Endometriosis is a condition where the menstrual lining, which is normally inside the womb, is found outside, such as on the ovaries or on the pelvic walls. It's a very common condition. People who have endometriosis may have no symptoms at all, but frequently they can have discomfort with intercourse, they can have painful menstrual cycles, and just in general pelvic pain. It's also very common in women who suffer from infertility. Fortunately, we do have excellent treatments for endometriosis as well. First step, though, is making the diagnosis. A good history and examination is the first step. Sometimes we'll do an ultrasound to look to see if there is any ovarian cyst that could be suggestive of endometriosis. Sometimes one of the most important aspects of female health is preventative care. I would say that pap smears and mammograms are really at the forefront as far as preventive care. Fortunately, pap smears are no longer required every single year. We begin pap smears at age 21, and between 21 and 30, assuming the pap smears are normal, these can take place every 3 years. After age 30, we can offer a test for a particular virus called human papillomavirus, which we now recognize as an important component for one's risk of developing cervical cancer. If somebody tests negative for the human papillomavirus with a negative pap smears can now take place at 5-year intervals, and this would be up till approximately age 65. If all pap smears have been normal, pap smears can be discontinued at that time. If at any point somebody has an abnormal pap smear, there are additional tests that we can offer to try to provide reassurance.
Dr. Gordon, I'm having some hot flashes and night sweats, and it's really starting to bother me.
Have you stopped menstruating?
Yes.
This is a very common symptom that occurs with menopause. About 75% of women will have hot flashes and night sweats with the onset of menopause. Fortunately, hot flashes and night sweats are not dangerous, but they are very bothersome. And we do have multiple options for you that can help you with these symptoms. few things that we can consider. First of all, the reason why somebody has these symptoms is a decrease in estrogen. So one of the options is replenishing the estrogen that your body was producing. Unfortunately, there are a few risks that go along with estrogen replacement, but these are relatively uncommon risks. Nonetheless, estrogen is probably still the most effective form of treatment for these symptoms. I don't believe you have any history of breast cancer or history of a blood clot in your legs or lungs, no history of a stroke or heart attack. These would be some of the things that we'd be concerned with estrogen replacement. However, with a negative history like that, you would be a candidate, and you're a very healthy person as well. Some people are a little concerned about some of these side effects, so there are some options that we can use. There are a number of herbal preparations that we have tried. We have a fantastic pharmacist here that we work with that helps us with herbal preparations that can also alleviate some of these symptoms. Fertility is concerned, this is something, once we've made the diagnosis, we can turn our attention to treatment. Infertility is defined as unprotected intercourse for 1 year without conception. If somebody is having this problem, again, the first most important step is a good history, good physical examination, trying to see if there's any risk factors that we can identify. At this point, we may want to do some hormone tests to determine if there's any hormone dysfunction. We may also want to do an X-ray called a hysterosalpingogram to determine if the fallopian tubes are open or not. We'll want to get a semen analysis early on, being that about 40% of infertility can have some male factor involvement. Finally, once we've done our evaluation, we turn our attention to treatments. And fortunately, almost everything that we can identify as far as a problem with infertility can be treated.
Some warning signs and things to look out for if you are postmenopausal is any abnormal bleeding, especially if you're done having bleeding or done having cycles. No bleeding is considered normal.
Women's health has several underlying factors which can sometimes lead to more severe health issues. The doctors chime in here with some helpful insights.
Stress can worsen almost any neurological condition. It's not to say that the patient is making up the symptoms or anything along those lines, but stress in itself can exacerbate many of the existing symptoms of any neurological disorder. Unfortunately, there's no prescription that I can give that gets rid of stress in anyone's life.
Dr. Majmundar speaks on women and allergies.
Women tend to utilize their health care a little bit more often than men, so we see a lot more women in the clinic, partly because they're bringing their children, and so we see a lot of food allergy that the mothers are worried about. But one thing that women are susceptible to more than men is being sensitized to cosmetics, perfumes, and even nail polish. So because of that, they tend to not only have more contact reactions, nickel is another one, but they also tend to have actually a higher risk of anesthetic allergy, because a lot of the preservatives that are used in the cosmetics ultimately are in the anesthetics, and so that tends to be an issue for women, much more so than men. So there are a lot of newer therapies in place now that there weren't about 10 or 15 years ago. So even if you've seen an allergist a long time ago, there are a lot of reasons to come back. Number one, you can have new sensitizations. It almost seems like the immune system cycles every 10 years or so. So if there are new environmental changes, you used to live in Arizona, now you live in the Midwest, there's not a lot of ragweed in Arizona. So new sensitizations, new environments in your daily life. And the second thing is that the science behind allergy shots has changed a lot. We have a lot of people who were on allergy shots before, their allergies come back, they're not sure they want to start up again. The technology, the dosing is a lot different, and the efficacy is a lot different. Things weren't as standardized before as they are now, so I do believe that very strongly changes the efficacy of shots and makes it much better and much more successful.
Some of women's health problems can be related to insomnia and obesity, especially when coupled with poor lifestyle choices. Let's listen to our doctor's take on these issues.
Insomnia is a sleep condition which affects women more so than men, although men can also get insomnia. Insomnia involves difficulty with either the initiation of sleep, the maintenance of sleep, or non-restorative sleep. Insomnia is also more commonly associated with obesity. Some recent research studies have suggested.
Well, obesity can predispose you to several long-term health issues. Obviously, diabetes, hypertension, other risk factors can predispose you as well to heart disease. So it's a major health issue. It's our major concern. It's probably one of the most frustrating things to help patients with, but it is probably the most important issue right now, causing several financial crises related to healthcare in general.
I have some patients that smoke, and I try to explain to them what smoking can do to you. Especially nowadays, we have more proof medically, research-wise, that smoking is very bad for you. And so my recommendation, of course, is just to quit. But in order to quit, you really have to have the willingness to do it, and that's the best way to quit smoking. So. But we're here to help them with anything that we can.
If a patient has overall made bad lifestyle choices in their office, addressing several health issues, I think the key to finding a good rapport with a patient and a key to addressing all these issues is probably to start out small. Start out tackling one goal at a time in terms of things like exercise, addressing healthier habits with exercises to start out with small goals like anything else. You try not to overwhelm them with saying you have to exercise 5 days a week for 45 minutes. Just getting them to do anything that they can. 20 minutes a day, 2 times a week, or even 5 or 10 minutes of walking 2 times a week is a small goal, and hopefully something that they can hopefully find themselves able to achieve.
I'm personally very big on preventive measures and screening tests, and I always tell my patients, because I have a variety of ages, can say from 15 to 85, 90, I think the most important thing is to at least come in once a year for a physical. And especially for women, there are a lot of screening tests that can be done depending on your age, pap smear, mammogram, blood work to screen for high cholesterol, for diabetes, and also check your blood pressure, make sure you're not getting hypertension. So at least once a year, it is very important for everyone to come in to have a physical done.
What makes a patient Pronger-Smith healthy? Let's count the ways. 1. Prenatal care. 2. Immunizations. 3. Physicals and yearly checkups, including labs, tests, blood glucose levels, and examinations. 4. A whole team of doctors top in their fields at your disposal for easier, faster referrals. 5. Electronic records that you can access in our patient portal. 6. Everything under one roof, easier access, more appointments, and satisfied patients. 7. Diets high in fiber and protein with less carbohydrates. 8. More fruits, vegetables, and a limited amount of healthy oils. 9. Less sugar, fat, and salt. 10. Stop smoking. 11. Exercise at least 30 minutes a day. A brisk walk counts. 12. Make an appointment. Our doctors have thousands of patients that would agree these 12 fundamentals can and do change lives. We are unique in our efforts to reach out to our patients because we care. We are striving every day to make prevention the key to our healthcare crisis in America. Our doctors are ready to care for you and eager to help you. We try to implement the best in medical advancements coupled with state-of-the-art equipment. Our physicians know that reaching out and getting patients involved with their own proactive healthcare will change the face of medicine. Prevention is our way, the Pronger-Smith way, which is leading to better healthcare, greater control of disease, and a better prognosis for our dedicated patients. Be healthy. Pronger-Smith Healthy.